We still want to have the choice when it comes to medical care.
We had an excellent example not too long ago, Denny. The woman in Calgary with the complicated birth. She ultimately gave birth to 4 identical babies, but she came from Canada to the United States to have that to deliver her children. I guess it's a rare example, but they weren't prepared to handle that kind of a case there in Canada,
Yep.
And so she came to the U.S. So what I'm getting at is a lot of people move from Canada for a short while anyway to come to the U.S. For medical care. We do have good medical care. We do have excellent hospitals.
But we also can't deny that we have problems, and some of the problems are created. We all know doctors, and if you have a candid conversation with a doctor, many of them will tell you, especially in obstetrics, that they're afraid anymore of the lawsuit. Mm-hmm. And while the trial lawyers will say, well, it's not really us, because if you look at the numbers, it doesn't really add that much cost when you add up, the lawsuits. Well, no, that's not the point. The point is, in many cases, many of our doctors are doing things 1, 2, or 3 times. They're duplicative procedures because they want to protect themselves from the potential of a lawsuit and the insurance costs that go along with that. We have a shortage of nurses in eastern Montana. Well, just rural America alone is part of the problem. But we also have a healthcare system in this country that almost, I don't want to say encourages bad behavior, but certainly does not discourage. We don't create incentives to do the right thing. Right now, if we overeat, we smoke, we drink and such, we hit 65, guess what? We get to go on Medicare, and Medicare is a government-run healthcare system that's going to pay to fix you. I'm going to put you back together at a time where it's a lot more expensive. I'd like to see us move in this country to a healthcare system where we create incentives along the way, that if you, drink in moderation, don't smoke, those kinds of things, that you get a tax credit or a deduction from your taxes for doing the right thing. And I'm not saying socially engineer. I'm not for that. But let's, rather than create a disincentive-based healthcare system in America, look for ways for preventive health, of getting people in. And that's why when we passed the Medicare prescription drug coverage for seniors under our majority in Congress, we put in a whole provision that when a senior attains the age where they qualify for Medicare, they immediately go in for an appointment to find out what's wrong today as you're going into the system, so that we can work at the earlier ages of Medicare on preventive health, so that as they age, they don't have the problems with diabetes and some of the other things that we see with our population as they age.
Yeah.
And so, the bottom line is that bill was not acceptable, but, it's easy to be critical from a political standpoint. That's a long ways from ever making it to the president's desk. And if they will get beyond the rhetoric and actually listen to what's being said, even Max, who's the sponsor on the Senate side, has said what the House did went way too far. We're not going to accept it. We've got a long ways to go, and that was just the first foray into the issue. We'll be debating it for days, and ultimately I hope that there's a piece of legislation that I can support as it goes on to the president, signed and is implemented.
It's no secret, of course, what you're saying, that the Democrats said that this was their fallback position. If they couldn't get Hillary Care passed a few years ago, then they'll start with S-chips. And as a matter of fact, there's even an expansion of S-chip here that's going to allow the parents of those children to be enrolled in the program as well. And that's a large step towards universal health care.
It is. And, we have to remember that health insurance is not going to solve the issue. The issue is the cost of health care. And so what we're trying to do is we're working, and I'm working through the appropriations process. That's the committee I'm on. And so I'm doing everything I can to see that we get dollars flowing to places like here in Billings Deaconess, now the clinic, St. Vincent's. I work with hospitals like up in Conrad, Montana, or up in Marr County, White Sulphur Springs, to help them get the technology necessary to, 1, provide the service, but 2, to make it cheaper. And what we have to do is try and make health care more affordable, and you do that by creating tax incentives for young men and women to go to dental school because we have a shortage of dentists, or to have a loan forgiveness for those that go into nursing who are willing to move to areas in Montana that might have difficulty because nobody wants to live there because of the cost of living, or the fact. And it's something as simple as a doctor in rural Montana can't get away for continuing education because they're the only doctor. And so you have to have telecommunications or distance learning being right into that community. Well, that's not a great lifestyle if they can never leave town because they're the only doctor. And so health insurance and S-chip is one aspect, but what we really need to be addressing ourselves to is the cost of health care.
I read somewhere that in ancient China, people paid their physician when they were well. You paid the doctor to keep you healthy. When you were no longer healthy, that's when you quit paying him and he had to go to work, get you healthy again.
Well, there's an incentive-based society, and we're just topsy-turvy. We don't help people until they're sick. And I was on the Health and Human Services Appropriations subcommittee clear back in the early 80s when I was in the state legislature, and it was a great subcommittee. Dorothy Bradley was on it, Cal Winslow from Billings, Pete Story, Chris Christians from Great Falls, and we came up with this big proposal called Priorities for People. And what it did is it identified the health care needs within Montana and put a price tag to it. And interestingly enough, same thing happens today. The preventive end of it was dropped, because we never have enough money to pay for the problem, that we can't look forward and try and keep problems from happening because, well, that's just out in the future. And where do you find the money to spend today to save something 20 years from now? Politicians just don't work that way, nor do the taxpayer. The taxpayer doesn't really want to spend an extra $25 million if it's going to save them $150 million in 20 years, because we don't think that far ahead. We as politicians are supposed to. And so I spent a lot of time trying to look at the preventive end of it, of creating incentives to see that it doesn't happen in the first place.
You'd do that if you were running a business, though, and to some extent you'd do that in a family as well.
Well, unless your business...
Maintenance on your house and that sort of thing.
Well, not always, though. We're all victims of saying, I'll fix that gutter.
When it's a problem.
Yeah, and then we do, and it ends up being a more expensive problem. It's human nature, and so we have to force ourselves to try and do the preventive, whatever it is.
Denny, let me take a break. We got a couple of calls for you, and we'll take those right after this break. Our telephone number, 1-866-627-5483. Congressman Denny Rehberg, our guest this morning.